I do a lot of peptides. I have a lot of patients always ask the same questions, and they're fair questions. So we're going to go through a bunch of different topics here, really rapid fire to discuss. Questions about peptides. How do I inject them? What's the difference? Can I mix them? We're going to kind of go step by step through the whole process here. Peptides, if you're new to the videos, the first video you're watching, peptides are small amino acids that work on specific hormones or enzymes or areas of the body to produce a desired effect. They could be done from everything from injections, creams, nose sprays, to IVs, and so on. So we're gonna go through some very simple things that you need to understand before you even start delving into peptides. So first of all, you have to understand what's gonna come to you. So when you get a peptide, from wherever you're getting it from, I recommend getting it from a reputable source, a doctor, and a reputable compounding pharmacy that's regulated by the US government if you're in the US, or whatever local area that you're located in, to make sure that you're getting what you're asking for, no fillers, nothing that could be life or health altering. So it's going to tell you if you're getting a pill, it's going to usually either be in micrograms, which is a percentage of a milligram. So if it says that you're taking 500 micrograms, and if you like the math, you can move the decimal point to in front of the 5, and then it's 0.5 milligrams, or just understand that it's 500 micrograms. So there are peptides that you're going to get, they're going to say you're going to take 100 micrograms, which is 1/10 of a milligram. So you can pretty much put a 10 under the number, and that'll give you an idea where you are. If something like a BPC or a TB4 says it's 500 micrograms, it means you're getting about a half a milligram. Every peptide has a desired dose. Don't go above what that desired or optimized dose is, because you're just going to get more side effects than benefit. So that's something that's individual to the person, the doctor, what you're being treated for. So you need to understand that. The lowest I could think, things like LL37, which is the antibiotic peptide, sometimes maybe 100 micrograms or even 50 micrograms to start with, to make sure that you don't have any side effects from it. Something like a thymosin beta 4 is going to be about anywhere between 500 and 750 micrograms to start with. There are people who, when you're talking about doing something like a MOTS-C, which is a once-a-week injection for energy, weight loss, and other things, that's 10 milligrams. So you want to make sure that you're understanding that the doses could be dramatic. Most peptides have a pretty narrow range of where you're going to be doing them. More is not always more beneficial. So that's the first thing you need to understand, is we're usually doing with every peptide, you're doing with micrograms, which are less than a milligram, or in more and more milligrams, which is a couple of the peptides that we're going to be using, like SS31, dihexa, things like that. So that's number one. First step is understanding the dose. Second thing is, if you are doing injections, which in most cases is the best way to deliver a peptide, it's going to give you the quickest reaction. And yes, it does spread. It does not mean you don't have, if you want to work on your shoulder and the doctor tells you that you're going to inject into your belly button, that's okay. You don't need to automatically be injecting in that local area. If it's being done for gut health or a nerve issue or pain, it doesn't have to always be in that right spot. By just going into around the belly button is usually going to work, or the doctor's going to give you a different way of doing it. But most peptides are better as in terms of injection. The only ones that I can think of that doesn't exist as an injection is dihexa, which is a brain boosting peptide, and Cmax and C-Lang, which are anxiety and nootropic sprays. Those are probably one of the few ones that are better as a spray than as an injection. So if you are going to start doing peptides, this is going to be your new best friend. This is an insulin syringe, and you need to be aware that most of them are either going to be 50 units, or some of them are going to be 100 units. So that's the first thing you need to understand. Understand that for every 100 units, that's 1 milliliter. So that's something that you may see. Some instructions are going to say in units, some may tell you in milliliters. Units is much easier, it's much more A to B. As you can see, I'm pointing here towards the 50 units. You just have to drop to that 50 units and then you're done. You don't have to worry about trying to convert the milligrams to milliliters. So that is what you need to be aware of. And again, if somebody tells you what you're going to normally do, again, you definitely want to speak to your doctor about it. This is not medical advice. Understand exactly what you need to do. You're usually going to take the cap off. You're going to draw up to whatever you're doing. If I'm going to 20 units, I'm going to pull it back. I'm going to push the air out and then redraw it up to 20 units. And then you're going to wipe off the area. We tell patients within about an inch of the belly button. And then you're going to usually go in straight like a dart. And that's it. And then just push the medicine straight in. Very easy to do. 95% of people have absolutely no issue with it in terms of pain level, discomfort. The questions become if you're having to do multiple injections, are you also doing like an Ozempic or Mounjaro injection? I mean, we have a couple patients who are actually, so those are things where it becomes the question of how many shots do you feel comfortable doing on a daily or weekly basis. So that's something you want to discuss with your healthcare provider initially, of how many shots you want to do. I have patients who are veterans of this, who do 6, 7, 8 shots at a time. There's other people who are just doing like 1 or 2, and that's all they feel comfortable with. You may get a small reaction, like a small little redness area. That's a body's response to it. That's fine, as long as there's no pain or discharge. You also may get a slight little bit of bump there. That's fine as long as the bump is not painful and the bump dissipates over the next day or 2. If the bump is not going away, if the redness is becoming painful, you want to let your doctor know about it, because that is not normal. There are people, for whatever reason, don't want to do multiple injections in their belly. You can do it on the inner thigh. It's the same procedure, but you want to make sure it's the inner thigh, not into the thigh muscle, because that is just too much muscle there and it will not spread throughout the rest of the body, and you're wasting your time and your money. So that's the first thing you need to understand. In some cases, what we'll do is we will up the dose as time goes on. From, if you're starting at 20 units, you may go up to 30 units and 40 units and so on. So that's something that you'll just have to, once after you look at it the first time, you'll understand what you need to do. Things get a little more complicated if you get what's called a lipophilized peptide. Lipophilized peptide means it comes to you as a powder as opposed to just come to you ready mixed as liquid. There is some data that shows the ones that are coming as a powder are going to be stronger because they're not already made. It's a very small difference. It comes down to cost, what's available in your area, patient preference. I mean, I have patients who request both the powder or the liquid. Most pharmacies will either be one or the other. There's certain ones like Mot-C, which almost always every time comes as a powder, just because it's easier to make that way. It's probably the only one that's usually uniquely powder. And if somebody sends you a powder, be if it's a Mot-C or any lipophilized peptide, like again, you get BBC, everything from BBC to CJC as a powder, you're gonna not only get a pack of insulin syringes, you're gonna get one of these big guys. This is a much larger syringe, and then you're gonna get a bottle of bacteriostatic water. That water is hopefully sterile enough that when you inject it into that powder, it's gonna make yourself a liquid. And then you're gonna go from this guy back down to the insulin syringe. So let's say if you're doing a vial of Mot-C, it's usually about a 1 ml of water. So what you're gonna do, this will come with a larger needle. You're gonna go into the vial of water, draw up to whatever they tell you, be it 1 or 5 or 10. I mean, this one goes all the way up to 30. There's some products that have you do that. You'll draw it up, and then you're going to put that needle into the vial. If this was the vial, you'll push that in there, and then you're going to just rub the vial in your hands for usually 30 seconds. It'll become a liquid, and then it either becomes a single-use dose, and that's usually most common, again, in Mot-C, where it's usually either a single or a 2-dose vial. Or if it's a vial of BPC, that's something that's now your vial for whatever the period of time is, 3, 4, 5 weeks. It goes in the fridge. You're gonna use it every day. Most powders do not have to be refrigerated, and they usually have a longer half-life, a longer useful date. So that's why they are advantageous. If you're getting something shipped from the East Coast and you live in the West Coast, it makes it a little bit easier and less risk of contamination or ruin the product when it ships to you. Make sure you're aware of that. Also understand that once you make that solution, it needs to be refrigerated. If you leave it out, then it's useless. That's the other thing you must do, is you want to make sure that you're refrigerating once you already mix it, and that's it. And usually what you're going to do is whenever you get products that have to be mixed yourself, you're going to get a couple of these syringes. It's not multi-use. These are one-shot deals. You're going to take one, mix it, and then throw it away. Bacteriostatic water, you can reuse. So that's what you'll get initially. Those are the 2 most common ways that you're going to get your peptides, is either as a liquid, where all you need is your insulin syringe and some alcohol pads, or if it's a powder, you're gonna need this part as well. And like I said, Mot-C is usually 10 milligrams. Other times you're going to, again, something as small as like an L37, it could be 100 micrograms, which is 1/10 of a milligram. So it's a 100 scale difference there. So those are the 2 most common things you need to understand in terms of where the dosing is, to understand the size of the vial. And this is another question I always get, is that some vials could be a 5 ml vial, and it'll say 2 milligrams per milliliter, which means that you have 10 milligrams. That's what you have. The key is how many milligrams do you have in that vial. That's 5 milliliters, but it's 2 milligrams, or you can have a 5 milligram vial, that's 2 milliliters. As long as it's the milliliters times the milligrams is 10, it could be different shaped bottles. It doesn't matter, it's the same thing. Your goal is how many milligrams, because your doctor is giving you a dose based on a milligram dose. It doesn't matter how big or small the vial is. If you get a large vial and has more milligrams, it's more effective for you cost-wise, but the goal in whatever your vial is you need to time how many milliliters is in there, times how many milligrams is on there and to get the amount of milligrams you have. That's the most important thing. That's what you need to be aware of, because otherwise I get these calls, well, this vial is really small, but wow, this is a much higher dose, higher milligram dose. Okay, that's why I'm taking it. This happens a lot more with some BPC products. It happens a lot with the weight loss products, is that they come in low dose and they come in very high dose because the range is a lot bigger. It happens a lot more in products that have a different range, dose ranges. Something like a CJC or some of the growth hormone peptides have a much more narrow range. You don't see that as much. It's pretty cut and dry. It's usually either 2,000 micrograms, which is 2 milligrams per mil. So that's something you just need to be aware of. So that's the other thing you need to be aware of is what dose, how many milligrams you have in the bottle. And if you know you're supposed to be taking 1 milligram a day and you have 20 milligrams, then it's going to last you for 20 doses. Not all vials will last for a month. That's something you also need to be aware of. Some vials, again, will last for 2 weeks. Some vials can last you for 3 months. Make sure you ask the doctor or the healthcare provider how long that vial is going to last for you. So that's another thing you want to be aware of, because all of this can get very complicated. Once you get used to it, it becomes very easy to understand. And I have patients say, hey doc, I want the large vial of this, a small vial of that, and then I want the cream version of this. And that's what we're going to get into now. Like I said, there's other peptides that come now in a nose spray, cream. So those are the two other main versions that you're gonna see out there besides IV, which I'm not really gonna delve into as much. Creams are great if you're taking it superficially, if you're doing it for your face. If you're doing it for the hair, not as much. You wanna make sure that you're doing some type of derm rolling to help the medicine get in that area. Some people are doing it with the face as well, if you're very experienced with it. At least some people are doing something like gua sha or some other type of stimulatory action to their face to make sure that the medicine gets in there. And there's tons of peptides that are now for the face especially. You got BPC, you got KPV, you got GHK, which helps boost the collagen. BPC is more for inflammation, but helps a little bit with collagen. And then you have the Lufazol and Erythroline, which are like the Botox peptides, help the skin kind of have more volume to it. I mean, those are the main ones that we use now for the face. And then again, if you're using something for the hair, zinc thymulin or PTD-DBM, or you're using GHK, again, your best bet is to do it locally in the areas, obviously, where the hair loss is happening, and you want to do something to open up the area. Again, usually it's a derm roller, or some people add in like a red laser cap or something like that as well to really optimize what that absorption is. Creams are also really good for local areas like joints, especially small joints, elbow, knee, ankle, wrist, fingers. It's not as great for the back, but it's okay. And again, I mean, the best way I explain it to patients, if Bengay used to work for you, some of those over-the-counter creams work, then the peptides will definitely help you. If it's something that's really deep, like a nerve that's get compressed by some arthritis or a disc, it's kind of 50-50 how much bang for the buck that you're gonna get there. So be aware of that. You probably get creams that usually try to do a little higher dosing because of not knowing the absorption, and don't mix creams initially. I have patients say, well, I put this on, and then I put this pain cream I got over the counter, or I'm mixing this with my skin cream. Until you know that it's working for you and what dose works for you, try to keep the creams individual. Don't mix them and try to make these master concoctions, because people get really bad side effects, especially if you're doing the face or the hair. You don't want to have an irritated face for 2 weeks or have irritation on the head or the scalp. If it's a joint, a little easier to hide, but still don't do it. Then we talked about nose sprays. Nose sprays for most peptides are great when you're trying to target the brain. We're talking about things like C-Max, C-Lank, both again for anxiety and for neurotropic activity, increased BDNF. Other peptides, again, where if you're using a BPC for cognition, which is helpful, very good to consider doing the spray. If you're doing it for generalized pain, kind of a last resort. I mean, it can help. Again, the brain does trigger some increased pain realization, so be aware of that. NAD is really good as a nose spray. It's not a true peptide. It's not a peptide, but it works. A lot of times you'll get it in conjunction with some of the other peptides like a BPC, and that works really well. Other medicines that now are coming in a nose spray, there is PT-141, which some people say works better for them. It is a medicine usually used for erectile dysfunction or sexual dysfunction or decreased libido for men and women. It can be done as an injection, which some people say may either be too strong or doesn't work for them, versus the nose spray, which people say works pretty well. So it's something to definitely look into for those types of criteria. And again, it's still the same answer. You want to make sure that those milligrams are somewhat similar to what you would get as an injection. The dose may be a little bit higher, a little bit lower to compensate for absorption, but it's still important. To summarize, what you need to make sure is, depending on how you're getting it, you need to understand what the preparation is going to be, what you need to have. Do I just need the little syringe for liquid? If it's a powder, I also need the mixing kit, which usually has this big syringe. If it's cream, the creams usually need to be refrigerated. So if you are traveling or have a nomadic lifestyle, be aware of that. The nose sprays are usually, again, most of them need to be injected, and most of them need to be refrigerated, so pay attention. If you do travel a lot and don't have access to a fridge, some of the pills don't need to be refrigerated. That may be your best bet, or some of the creams may not need to be refrigerated. So talk to the doctor. We can talk to the pharmacy. There may be some preparations that don't need it. As more and more people are starting to travel again, they're being more and more concerned about that. I've prescribed probably thousands of peptides at this point. You should not at this point need a note to board a plane with them. Even if you have syringes with you, diabetics go on the plane all the time with insulin syringes, or some women who try to do fertility. You should not need a note. They should not give you a hassle regarding syringes. If you're using larger needles, if you're doing an intramuscular injection, still not using an issue, because again, women are doing fertility, men are using it for testosterone, other people use it for like B12, should not be an issue. You do not usually need a note. You can definitely go on the country's website, but I've had patients travel all over the world and none of them have had to have a note in terms of needing it to get on a plane or get into a country or whatever. Most people know what it is. They can also search it, and it's not something it's so common at this point. Make sure you know what your goals are. Make sure you understand that if this is what's involved with getting an injection, the needle is very, very small, should not intimidate you at all. And once you get the process down, it's very easy. Initially, it can seem very overwhelming. Start slow if you're new to it. Try to do maybe 1, no more than 2 injections at a time, and then you can add more. It's like juggling or spinning plates. Just build up until you feel comfortable. You feel comfortable with where you are, and make sure you can tell where if you're getting a side effect or something, you know which one it's coming from. So if you have any questions, feel free to put that in the comment section. We'll answer them for you, or at least give you some type of guide. And if you like the content of our channel, please like and subscribe. See you guys soon.